The Quebec government is no longer going to offer the COVID-19 vaccine free to everyone. Only people Quebec considers high risk, such as those 65 years of age and older or with compromised immune systems, will be able to get it for free this fall. Everyone else will have to pay. Here to tell us more about this decision is Quebec's Director of Public Health, Dr. Luc Boileau. Thank you for joining us.
Thank you. Thank you.
So, Dr. Boileau, what prompted this change?
Well, the first thing is that it's not going to be offered. It's going to be offered for all the people that are at risk, of course. And the other will have to wait after those will be vaccinated to have access to the vaccine for COVID, if there are some that will still be there, which is probably the case. So the main issue here is that we do not have anymore since this year. I mean, it's the beginning of the new campaign. Any vaccine coming from the federal government. For the last 5 years or so, it was completely offered freely by the Canadian government, which was okay, of course. But since a few months, it's not the case at all. So we have to forecast the numbers of doses that are required, and with the expertise that we've developed during the last few years, and especially for the people that are at risk and the others that are not, we had the consideration of the Community of Immunization of Quebec, which is led by Dr. Caroline Quach, who's going to replace me in a few days. So with that in mind, we considered that it's not a great advantage to be vaccinated if you're not in group that are at risk. Of course, for some it will be relevant to be vaccinated, which is okay. So they will be able to obtain it in the different pharmacies, and they will have to pay for that. But for the others that wish to wait until the end of this actual campaign, that will, of course, as I said, prioritize the people that are at risk, the one that you have designated at first.
Okay, let me just jump in here for a moment. What will people have to pay? Do we know yet what the cost will be to them, Dr. Boileau?
We don't know the cost. It's something that's going to be fixed by the pharmacists themselves. We estimate that we have heard some prices that are around $100 or maybe more. I don't know. But the point is that those are for people that would wish to be vaccinated earlier. And it's not a recommendation coming from us to get vaccinated. I think that it's a privilege that some might wish to have, or they could wait until the end of our prioritization cases and groups, I mean, to be vaccinated then after with the vaccine that will be still some probably have enough to cover some that would wish to be vaccinated if they are not in the group that are prioritized, of course.
All right. Dr. Luc Boileau, thanks so much for your time today. We will, of course, continue to follow this story. Merci.
Thank you. Merci.